Dear colleagues, in today's video, we present a case of male hypogenitalism. During the presentation, we will focus on disorders of sexual development, or DSDs, and in particular on hypospadias. Disorders of sexual development are characterized by the presence of atypical external genitalia that do not allow for proper sex determination through imaging techniques. DSDs are divided into four main categories: DSDs of the XY fetus, DSDs of the XX fetus, DSDs of fetuses with sex chromosome aneuploidy, and syndromic structural DSDs. From an ultrasound perspective at 12 to 14 weeks, the genital tubercle is similar in size in both sexes. It is possible to distinguish the sex thanks to the sagittal scan, where you can see the clitoris pointing caudally and the penis pointing cranially. During the second and third trimesters, visualization becomes easier thanks to the appearance of the echogenic lines of the female labia in the axial scan and the morphology of the penis and scrotum in the transverse and sagittal scans in the male fetus. When examining the external genitalia, it is important to be able to rule out the typical ultrasound findings of aneuploidies and syndromes with atypical genitalia, such as Charge syndrome or campomelic dysplasia. For this reason, it is advisable to focus on the major organs and fetal skeletal structures. On ultrasound examination, we observe a fetus at the 23rd week of gestational age with male hypogenitalism. The sex was confirmed by the mother's NIPT results. The most likely suspicion is hypospadias, that is, the opening of the urethra along the ventral portion of the penis. Hypospadias can be characterized. Thank you. Depending on its severity, that is the position of the urethral opening on the ventral surface of the penis, which can be anterior and therefore less severe, or closer to the scrotum and thus more severe, the presence of a penis with a blunt tip, the presence of cords, meaning fibrous bands that curve the penis ventrally, and the actual length of the penis are all considered. In some cases, by using color Doppler ultrasound, it is possible to visualize the abnormal urine flow, which will originate from the ventral surface of the shaft instead of from the tip of the penis, and will have a fan shape rather than a linear one. However, the best diagnostic tool remains the axial view. Thank you. Of the genitals and the orthogonal view of the genitals, that is, the possibility of using 3D imaging. From an etiological point of view, the failure of the closure of the urethral groove, which normally closes between the 11th and 14th weeks, is due to excessive exposure to estrogens or antiandrogens, possible placental insufficiency, therefore low levels of beta-HCG, genetic problems such as trisomy 13, trisomy 18, and other associated anomalies. Hypospadias is the most common congenital male genital defect, affecting about 1 in 200 to 250 males. It is affected by this, but nevertheless, it is always advisable to recommend genetic counseling in all cases. First of all, with non-invasive screening of circulating fetal DNA. And then, if necessary, with an invasive test recommended by the geneticist through an amniocentesis, which still remains the gold standard. Thank you for your attention.